We've seen what COVID can do to the healthcare system. That's an acute illness, but what we are facing is a tsunami of chronic disease.
The rest of Australia has prevalence rates of about 30 to 40%, and for us it's almost as high as 90%.
There is a higher prevalence than probably anywhere else in the world for type 2 diabetes.
I would describe the surgical ward as the Wild West of diabetes.
We've come to the Flynn Drive Renal Dialysis Unit in Alice Springs today, where hundreds of patients come through this facility, which is combined with a nearby renal dialysis unit at Gap Road in Alice Springs, one of the biggest in the Southern Hemisphere. In fact, it is the biggest in the Southern Hemisphere. There's 420 patients on renal dialysis in Alice Springs. That's an extraordinary number in a population of 30,000 people, and the numbers are only getting greater and greater.
It's called a silent epidemic here by staff. This is a crisis that needs far more attention than it's currently getting.
My name's Dr. Paul Seacombe. I'm an intensivist in the Alice Springs Hospital, also the head of unit. The burden of type 2 diabetes in particular is extraordinarily high in this intensive care unit. We see a lot of patients who present not only as a direct result of the type 2 diabetes, but also as a result of the complications arising directly from type 2 diabetes.
I've been working here for 8 years in Central Australia, and since I began working here, it was obvious from the outset that there was an incredibly high prevalence of type 2 diabetes among children and young people. My first experience of this here was seeing children as young as 8 to 10 with a severe phenotype of type 2 diabetes, and I hadn't seen this anywhere else that I'd worked in Australia. The severity of it is much higher than elsewhere as well. It's a different type of type 2 diabetes almost. It comes early and it comes incredibly hard. A child can go from having normal sugars, no signs of diabetes, and then 6 months later, 1 year later, they have a severe diabetes, needing insulin, needing admission, causing health complications.
Trajectory to me is absolutely shocking and heartbreaking, because I also have children, and they are grown-ups now, but if I had to envisage that potentially was my child, I would be absolutely devastated.
So about 2/3 of our caseload in intensive care are Aboriginal or Torres Strait Islander patients. That's higher than you would expect given the distribution in Central Australia, but also reflects the burden of type 2 diabetes in this population in particular. We are 10 bedded intensive care that's made up of 6 ICU beds and 4 HDU beds. That gives us a ICU bed per 100,000 head of population in our catchment area of nearly 13. It's about 1.5 times the rest of the country, and that's reflective of the disease burden in this bit of the world.
The chairs are always a problem, and we are always at the moment in terms, we sometimes have to resort to deferment of dialysis, things like that, when there are too many patients turn up for their scheduled treatments and there are not enough chairs. So as it stands now, we have a huge number of people who, for whatever reason, they have this problem of missing their scheduled treatments. So we are just surviving on a day-to-day basis by people who miss their treatments. So we wouldn't be able to accommodate all patients on dialysis if they turned up for their scheduled treatments.
There are a lot of cases where I see young teens who they don't have a mum or a dad because they died from their diabetes at 35.
With very high admission rates with diabetes-related foot complications, and sometimes also toe and foot amputations.
I have worked in many other places in the world, but nowhere have I seen the kind of incidence and prevalence of kidney disease for a small population base.
I suspect that if this endemic type 2 diabetes that we see here was present in the big cities, there would be outcry, there would be money spent hand over fist rectifying the problem. But buried in regional Australia, in particular in the middle of Australia, where the rest of the world isn't watching. I fear that the endemic, the tsunami of type 2 diabetes is largely forgotten about.
If they happened in Sydney, if they happened in Adelaide and Melbourne, there would be outrageous outcry, like it would not be tolerated. The emergence of type 2 diabetes in children in Central Australia is a catastrophe. It's going to ruin lives and it's going to impact future generations.
When you have young people transitioning on to dialysis in their 20s and the 30s and suffering the effects of chronic diseases like diabetes, it is almost a disaster. But looking at it from different angles, I'm sure a lot of things can be done to improve the situation.
It's about ensuring food security, it's about minimising alcohol consumption, it's about exercise. All of these things are primary and public health care issues that we need to address.
We're talking about basic human rights here.
Yes, basic human rights, about safe housing, appropriate housing, about the right to education, about the right to access culturally and linguistically appropriate healthcare.
That's not happening.
It may not be happening, yeah.